Many people ask me why Medicare is so strangely structured and financed, and I tell them it really is something that's a function of our colonial history. And there's an ideological divide that has been present in our country since the country began, and even before we became a nation. And it's maybe best epitomized by the differences between two of our great early politicians, Thomas Jefferson and Alexander Hamilton. Thomas Jefferson, who was, as many of you know, a gentleman farmer, was very much a defender of individual liberty, the right to make your own living and be independent. He was one of those who considered that welfare was something that undermined the spirit of man. And also felt that individuals should take responsibility for how they live their lives. Whereas Alexander Hamilton, who had equal power in the government back in the colonial times, believed much more that there should be some sense of a collective, that we would be a nation trying to take care of each other, but also, much more importantly, use the power of being a collective to achieve things like have a national bank and federal military and things that enabled us to do things that individuals couldn't do. Jefferson also believed in the private sector, whereas Hamilton was very much into the government being proactive, and Jefferson felt that states should have most of the power of governing, whereas Alexander Hamilton very much believed in the federal government having powers to do things. And so this kind of divide permeates the policy developments in healthcare and many other policies that the country faces back then and today. So between colonial times and 1965, when Medicare passed, the notion of health insurance sponsored by government was brought up many times. There was no health insurance back at the turn of the century in 1900, but somewhere in the middle of the Depression, hospitals in particular started noticing that people couldn't afford the care, and the hospitals were increasingly becoming more technologically advanced and more costly. So both the hospitals and the doctors started thinking about how do we help cover people, but they were very much Jeffersonian about it. They only wanted private sector solutions. And back right after World War II, Harry Truman tried to suggest that we should have universal coverage sponsored by the federal government for all Americans, and the American Medical Association went on a campaign to defeat any possible federal intervention in the practice of medicine. So the way the Medical Association presented the proposition was that the government would be at the bedside in between the physician and the patient, and their poster, which I'm showing you here, was a famous painting of a physician visiting a home and seeing a sick patient. And the poster points out that government insurance would bring politics into the picture and ruin healthcare as we know it. They kept that posture up for many years and actually were supportive of private insurance for physicians only because they hoped it would keep government out of insurance. A somewhat more recent poster, 1965, was Ronald Reagan when he ran for governor of California. And by that point, it was pretty clear Medicare was well along into being passed, and Ronald Reagan ran against it, saying, we're against forcing citizens, regardless of need, into a compulsory government program, socialized medicine. These are all the kind of loaded words that get people very upset about the entry of the federal government into the health insurance domain. My favorite part of this is that he said, if it stands, meaning Medicare, one of these days you and I are going to spend our sunset years telling our children and our children's children what it was once like in America when men were born free. So this is the kind of political dialogue that tends to bring out the ideological divide in our society and has been present throughout the centuries. Before Medicare passed, there were a pretty broad ideological divide present in who was for and against Medicare. You can see on the slide those who were for Medicare were mostly unions, lowly workers in the healthcare system, people who were advocates for the poor and disadvantaged, Farmers Union and the Socialist Party, so people who might be expected to welcome government helping take care of disadvantaged populations. Very much against Medicare was the American Medical Association. Again, the difference between doctors and nurses, the doctors felt that they were the private entrepreneurs and people who really drove the system and very much wanted government to stay far away from their professional domain. American Hospital Association also was against Medicare until the last minute. The private insurance companies also were very unsupportive of seeing the government come into the domain that they operated in, which was insurance. And then some of the large business organizations were very much against Medicare. So again, private sector on the against side, much more the collective on the for side. But what changed the whole political landscape was the presidential election in 1964, in which Barry Goldwater ran. He was a very conservative Republican from Arizona, very much for private sector, for keeping government out of business and private lives, wanted to overturn the New Deal and a lot of the welfare state that people felt FDR had begun back in the 30s. And then there was Johnson, LBJ, who was obviously running right after the assassination of John Kennedy and had obviously some public sympathy on his side in that regard. But you can see that the election was a landslide. Johnson won all but 6 states. And he also, in the process of the landslide victory, also was able to convert most of the House and the Senate into Democratic hands. So this was really one of those rare windows of opportunity where the president and the Congress are all the same party, and you have a major piece of legislation in front of them, and they grabbed this opportunity to try to make Medicare happen. Republicans, as a result, began to say, well, you know, this is going to pass, so we want to have some way to influence this legislation. And they began, before Medicare passed, they began to say, well, what the LBJ and all the prior Democratic presidents have been wanting is hospital care, is hospital coverage for the elderly. That's really not enough. That's too narrow a set of benefits. What about doctors? And they brought in 2 different bills. They brought in one that would help cover physician services. And then they also said that Medicare, their biggest criticism of Medicare, because they didn't like government paying for people who could afford to pay for themselves, their biggest criticism was that Medicare was not means tested. You didn't have income eligibility requirements to be able to qualify for Medicare. And so they brought in another bill that brought in a comprehensive government-sponsored health program, but that required income eligibility for people to be able to access it. And what Congress did in that year between the presidential election and the year that Medicare passed was they put together what they called a 3-layer cake, where Part A, the bottom of the cake, probably the biggest amount, is the traditional, what the Democratic presidents had been advocating, which is the hospitalization piece. And it's compulsory and it's tax-based, so it's very much the government and much more of a redistribution of wealth from the worker to the elderly. The middle part of the layer cake, Part B, is the physician piece. That's voluntary, and the beneficiaries taking individual responsibility for paying for a big part of that premium. That beneficiaries are supposed to pay 50% of the cost of Part B. And the third layer was really almost an afterthought, but it was in reaction to the concept that there should be some income eligibility considerations in deciding who should get access to comprehensive care, and that was finally became Medicaid. That was the third layer of the cake. In those days when Medicare passed, the bills that passed both Medicare and Medicaid at the same time were referred to as the 3-layer cake. In July of 1965, Lyndon Johnson, you can see him sitting at the desk here with his wife Lady Bird behind him, and Harry Truman and Bess Truman to one side, and Hubert Humphrey, another Democratic politician behind Lady Bird, signing the bill into law, and they considered a major accomplishment of the pro-government, not quite Hamiltonian, but a success for those who wanted to have government serve the population in a more active way. As a result, what we see is the structure today, Part A and Part B. This is traditional Medicare. You'll hear more about the changes to Medicare, the non-traditional Medicare later with Part C and D, but traditional Medicare is where most beneficiaries are still enrolled. So Part A is hospital benefits. You can see it's hospital as well as post-hospital care. It's mandatory. Everybody, when they turn 65, is in it, and everybody under 65 who works pays into it. The financing is a payroll tax, which was much smaller when the bill passed, but is now up to, I think, 2.9%, with a little bit of add-on these days for wealthier people. And providers back in the original bill were paid cost-based reimbursement, which meant whatever you spent, you got paid. That was just to get the provider opposition to die down a bit. That changed obviously over time, and we'll talk more about that later. Part B, physician services, both physician and all outpatient services, as well as drugs that physicians administer in the office. It's voluntary out of respect or a nod to the notion that the beneficiary should be responsible for their health and decide whether they want to join or not. It was originally meant to have the beneficiary pay at least 50% of the cost. That ultimately became not affordable, so it's now down to 25%. Part B has a deductible, but more important and more expensive, it has some pretty significant co-payments and co-insurances. 20 to 40% of the Medicare approved fee. Originally, the physicians were paid what's called usual, customary, and reasonable, which is pretty much like whatever they wanted to charge. That became unsustainable as well and became resource-based in the early 1990s, based on research done actually here by Professor William Hsiao of the Harvard School of Public Health. And that is how we got the crazy Medicare that we have today. When you look at the political forces that gave us this crazy structure, you might want to think about whether it's continuing today and in what ways you see it in the way the Affordable Care Act, for instance, was produced, and the way the different features of private and public and who pays for what that are present in the Affordable Care Act.